1. A CNA instructor is planning a module on infection control. Which principle of adult learning should be prioritized to enhance learner engagement? A. Repetition through rote memorization. B. Frequent testing without feedback. C. Relevance to clinical practice. D. Passive video observation. 2. During a clinical skills demonstration, a student fails to don gloves before contact with bodily fluids. What is the most appropriate instructor response? A. Ignore the mistake to avoid embarrassment. B. Reassign the student to a different task. C. Halt the activity and provide immediate corrective feedback. D. Document the incident without intervening. 3. Which method best ensures alignment between CNA infection control curriculum and OSHA standards? A. Develop course content from textbook excerpts. B. Base instruction solely on instructor experience. C. Review and incorporate the latest OSHA guidelines. D. Use hospital policy manuals as the sole resource. 4. What evaluation strategy best measures a student's competency in aseptic technique? A. Multiple choice quiz. B. Instructor observation with rubric. C. Self-assessment worksheet. D. Open discussion. 5. Which is a legal responsibility of a CNA instructor under CDC guidelines when students are exposed to bloodborne pathogens? A. Refer the student to a private physician. B. Notify OSHA anonymously. C. Document and follow the exposure control plan. D. Ignore the exposure unless symptoms develop. 6. An instructor notices a student consistently forgets to perform hand hygiene. What mentoring approach is most appropriate? A. Issue a written warning. B. Schedule one-on-one coaching. C. Reduce clinical hours. D. Ignore unless a patient is affected. 7. What is a key adult learning principle relevant to teaching infection control? A. Adults prefer repetitive drills. B. Adults learn best through independent reading. C. Adults value learning that is problem-centered and applicable. D. Adults require strict authority structures. 8. In a simulation exercise, how should an instructor document a student's failure to follow PPE protocols? A. General notes in a shared file. B. Narrative in the student's confidential performance record. C. Email to the facility manager. D. Verbal report to peers. 9. Which instructional strategy supports diverse learning styles in infection control training? A. Repetition of facts via lecture only. B. Video presentation without interaction. C. Combining discussion, demonstration, and simulation. D. Sole use of textbook readings. 10. During a clinical evaluation, how should an instructor manage a student's emotional response to feedback? A. Avoid giving feedback during clinical hours. B. Wait until the end of the course to review issues. C. Provide supportive, constructive feedback promptly. D. Delegate the conversation to another instructor. 11. When developing infection control curriculum, which component ensures measurable outcomes? A. Broad goals. B. Anecdotal examples. C. Clearly defined learning objectives. D. Vague expectations. 12. Which documentation practice is compliant with federal training standards? A. Storing student evaluations in a locked drawer. B. Recording student performance on personal devices. C. Maintaining handwritten notes without signatures. D. Posting performance data in the break room. 13. Which characteristic best defines effective mentoring in infection control instruction? A. Directive and critical. B. Passive and observational. C. Collaborative and supportive. D. Task-oriented only. 14. When planning instruction for adult learners, which approach enhances motivation? A. Emphasize rote memorization. B. Create content based on learner goals. C. Discourage questions. D. Use a lecture-only model. 15. A CNA instructor develops a new infection control training module. What must occur before implementation? A. Share with students directly. B. Submit to OSHA for approval. C. Align with institutional and regulatory standards. D. Upload to online forums. 16. What should a CNA instructor do if a student falsifies a clinical log? A. Ignore and proceed with the course. B. Have a peer verify the data. C. Document and follow institutional disciplinary policy. D. Have the student rewrite the entry. 17. Which communication strategy improves learner retention of infection control principles? A. One-way lecture delivery. B. Use of hypothetical case discussions. C. Silence during skill demonstrations. D. Avoiding interruptions for questions. 18. An instructor evaluating students in a long-term care setting should use which tool? A. Student satisfaction survey. B. Pre-course questionnaire. C. Competency checklist aligned with learning outcomes. D. Peer evaluations. 19. Which curriculum feature supports compliance with CDC hand hygiene recommendations? A. General policy overview. B. Embedded videos without hands-on practice. C. Specific, hands-on performance objectives. D. Instructor-led Can-Day only. 20. A CNA instructor notices discrepancies in a student's training record. What is the appropriate first step? A. Report to the health department. B. Edit the record independently. C. Discuss the discrepancy with the student. D. Disregard as a clerical error. 21. Which approach best fosters a growth mindset in CNA trainees? A. Publicly compare performance. B. Emphasize fixed standards. C. Encourage reflection and resilience after errors. D. Punish first-time mistakes. 22. A student asks about the rationale behind transmission-based precautions. Which instructional response is best? A. Refer them to a textbook. B. Explain using real-world patient scenarios. C. Dismiss the question as off-topic. D. Suggest they ask a peer. 23. What type of feedback is most effective after a student contaminates a sterile field? A. General praise. B. Delayed feedback at course completion. C. Specific, immediate, private feedback. D. Peer-led correction. 24. What aspect of clinical instruction ensures regulatory alignment? A. Instructor discretion. B. Random audits by peers. C. Standardized checklists based on CDC OSHA guidelines. D. Informal skill assessment. 25. A CNA instructor identifies a gap in learners' understanding of MRSA protocols. What is the first step in revising the curriculum? A. Remove MRSA content. B. Wait until the course ends. C. Conduct a root cause analysis of the learning gap. D. Skip to more advanced content. 26. What is a required component of a train-the-trainer program under most state regulations? A. Instructional design coursework. B. OSHA CDC infection control certification. C. Shadowing an administrator. D. Peer teaching only. 27. How should a CNA instructor address a student's consistent misuse of PP despite repeated correction? A. Terminate the student from the program. B. Document performance and implement a remediation plan. C. Ignore unless a patient is harmed. D. Assign the student extra homework. 28. A CNA trainee exhibits anxiety during infection control drills. What is the best mentoring response? A. Ignore the behavior. B. Publicly ask them to explain their discomfort. C. Provide reassurance and tailor support strategies. D. Remove the trainee from simulations. 29. Which learning strategy reflects andragogy in infection control education? A. Mandated lectures with no student interaction. B. Case-based learning involving real clinical scenarios. C. Quiz-only instruction. D. Textbook assignments only. 30. A new regulation mandates updates to infection control procedures. What is the instructor's role? A. Wait for student feedback. B. Rely on facility staff for updates. C. Revise and implement changes in training content. D. Post updates without discussion. 31. What is the most effective evaluation method for infection control skill retention? A. Verbal questioning. B. Written exam only. C. Periodic hands-on demonstrations. D. End-of-course survey. 32. How should an instructor handle conflicts between students during clinical rotations? A. Ignore unless patients complain. B. Allow students to resolve issues independently. C. Facilitate structured conflict resolution and mediation. D. Document and forward to HR. 33. Which component of curriculum planning ensures alignment with adult learning needs? A. Instructor preference. B. Compliance-only goals. C. Learner-centered design. D. Repetition of outdated content. 34. What is the primary reason for maintaining detailed student training records? A. Marketing purposes. B. Legal accountability and compliance. C. Convenience. D. Student preference. 35. A student challenges the relevance of infection control protocols. What is the best instructor response? A. Refer them to policy manuals only. B. Avoid answering directly. C. Relate the protocols to patient safety outcomes. D. Tell them to ask later. 36. During clinical instruction, what is the best way to model proper glove removal? A. Describe steps verbally. B. Perform the skill while explaining each step. C. Show a video clip without interaction. D. Let students figure it out. 37. In mentoring, what technique enhances self-directed learning? A. Withhold resources. B. Encourage goal setting and reflection. C. Impose a strict study schedule. D. Focus solely on compliance. 38. What is the best method for identifying at-risk students during infection control training? A. Wait for final evaluations. B. Monitor informal conversations. C. Analyze performance trends and feedback. D. Ask peers for opinions. 39. What is a CNA instructor's ethical duty when discovering errors in institutional infection control practices? A. Report to public media. B. Avoid addressing the issue. C. Report internally according to protocol. D. Conduct an independent investigation. 40. When facilitating a group discussion on TB precautions, which strategy enhances learning? A. Ask yes/no questions. B. Pose open-ended, scenario-based prompts. C. Recite CDC guidelines only. D. Discourage debate. 41. What is the most effective way to evaluate an instructor's own teaching performance? A. Ignore student feedback. B. Review end-of-course grades only. C. Analyze feedback and seek peer review. D. Rely on seniority. 42. A CNA student fails to meet infection control competencies. What is the instructor's next step? A. Dismiss the student. B. Inform the state licensing board. C. Provide remediation and reevaluation opportunities. D. Let the student proceed to the next level. 43. How can CNA instructors reduce cognitive overload in infection control modules? A. Deliver content all at once. B. Include lengthy handouts. C. Break content into manageable segments. D. Skip foundational principles. 44. What is an example of transparent documentation in CNA education? A. Keeping instructor notes private. B. Allowing students to edit their records. C. Recording competencies with signatures and dates. D. Deleting records post-graduation. 45. What principle supports the use of feedback loops in CNA instruction? A. Social learning theory. B. Classical conditioning. C. Adult learning theory. D. Gestalt psychology. Infection control CNA OSHA CDC certified. The Infection Control CNA OSHA CDC certified test is a specialized assessment designed to evaluate the knowledge and instructional competency of certified nursing assistant CNA instructors in infection prevention and control practices. Rooted in OSHA and CDC guidelines, the exam focuses on critical areas such as standard precautions, transmission-based precautions, personal protective equipment PPE, and proper hygiene protocols. It assesses the candidate's ability to teach, evaluate, and mentor students in clinical environments while maintaining regulatory compliance and ethical standards. The test also measures understanding of adult learning principles, curriculum development, clinical supervision, and effective communication strategies. Passing this test certifies that the instructor can competently deliver infection control training that meets both federal and state regulatory requirements in healthcare education settings. Here are the top 5 beneficial uses of the sample exam. 1. Ensures regulatory compliance. The test confirms that CNA instructors understand and apply OSHA and CDC infection control standards, helping training programs meet federal and state regulations. 2. Improves clinical instruction quality. Certified instructors are better equipped to teach infection control protocols effectively, ensuring that future CNAs apply safe practices in healthcare settings. 3. Enhances patient safety. By preparing instructors to teach correct procedures, the test supports the development of CNAs who can prevent the spread of infections, reducing risks for patients and staff. 4. Strengthens professional credibility. Certification validates the instructor's expertise, increasing trust among employers, students, and accrediting bodies. 5. Supports career advancement. Passing the test can open doors to higher-level educational or supervisory roles within CNA programs, public health training, or long-term care facilities.